talking today with Dr. Vincent Hsu. He's the Executive Director for Infection Prevention at the Central Florida Division for AdventHealth. Thank you so much for being here, Dr. Hsu.
Thank you, Garrett.
So, Dr. Hsu, with the coronavirus concerns that are out there in conversation, my question is, what do we do for treatment? How is coronavirus treated?
Yeah, many viruses, including coronavirus, do not have any specific antiviral treatment. Generally, the approach is, for most viruses, is that it's going to get better on its own, and we use what we call supportive care, treating the symptoms, lowering the fever. If there's severe disease, we support with oxygen and other measures. Hopefully, we will have some specific treatments. There are some therapies that are in trial right now, but none have been definitively shown to alter the outcome as of yet.
So if a person feels like they are sick, one person might say, well, there's no treatment for it anyway. I think I'll just stay home and not go to my doctor. Is that the right choice to make?
Yeah, it really, that's a great question. I mean, I think there's a lot of concern. People want to know whether they have the specific virus, the coronavirus. Certainly, if my advice to patients would be assess yourself. If you are sick enough to seek care, call the emergency or urgent care of your doctor's office ahead of time. Let them know that you've got a fever and a cough, so they will know how to prepare you as you arrive so you don't potentially infect someone else. If, however, you are not feeling too bad, but you have a cough or cold, you can call your doctor's office for more information on what to do. Also, the public health department, the local public health department most of them have hotlines that instruct a patient what to do and how to call and how to get tested, and that can be done actually from home.
So you have been at the tip of the spear for AdventHealth in all the planning and response to COVID-19. What happens when a patient presents at an AdventHealth facility? How is AdventHealth dealing with it? And how do we know that we're going to be safe here?
Yeah, AdventHealth has been preparing for weeks. As soon as we found out that there was a disease occurring in China that was somewhat mysterious and was first identified as a coronavirus, we started taking action. The first thing that we always want to do, and first thing we have been doing, is just to identify a patient that might have that. So at all our AdventHealth facilities, any patient that comes in, there's plenty of signage stating that if you've been to certain countries, if you have fever or cough, please let someone know. And then we also ask them, upon registration, have you been to one of these countries? Do you have these symptoms? Because the first thing we want to do is to identify a potential patient that might have this so that that person can be safely isolated and tested for that. On a larger scale, AdventHealth facilities have been also preparing for a larger number of patients that should come if we were to get a lot of local community spread. So far, that has not happened yet, which is great, but we are prepared to deal with larger numbers of patients. And of course, if it's declared a pandemic or there's widespread transmission, we're also prepared and we have plans to take care of patients in that instance.
So it's an important thing to note that we are still as of the time of recording this message, we're still in a state where it exists. There are hot spots in certain areas, but not currently in our communities.
Right, the key word is prepare, not panic. And that's what we are doing. We don't know what's going to happen in the next few days. I wish I had a much clearer crystal ball, but we need to be prepared for all eventualities, and that's what we're doing.
Well, we take comfort in that, and I thank you so much for taking the time to talk with us.
Thank you, Garrett.